proposals, not gonna be this bill passed. Like, it's not, the bill's not gonna affect.
Yeah, I can tell you, I was gonna say that and then I said, be quiet. I
That's
told
what
myself to
I
be
was
quiet.
thinking too, because I was, when he started talking about the Morgan State contract, I was like, no.
Yeah.
I didn't-
I know, and I said to myself, don't leave it alone. Yeah. All right. All right. So good afternoon and welcome to bill hearings for the House Health and Government Operations Committee. I'm your chairman, Jocelyn Peña Melnick, joined by my vice chair, Bonnie Collison to my left, and the attorney, Lindsay Rowe to my right. I kindly ask for your patience if we encounter any technical or streaming issues. I'm going to go through some of the rules in this committee, and I kindly asked if you can follow them first. If you can set your phone to vibrate. I don't know where mine is. Here it is. I'm putting it, if you can please silence it, that would be great. As a reminder, there's no food or drink allowed in the gallery. For each bill, we're gonna hear from the bill sponsor and the sponsor panel, followed by witnesses. In this committee, I have decided to not time the sponsor, but please don't abuse it. All right, no more than 5 minutes. Everyone else will get 2 minutes to provide their testimony. There's a timer display on the screen and a sound will play when your time has expired. I don't want to be rude, so just wrap it up. And please adhere to our wonderful committee. We are in the hardest week of session. This is what is called crossover, where all the bills have to cross to the other chamber, and we work around the clock, including this coming Saturday. I thank you in advance for making yourself available for all the subcommittee meetings, for the numerous, voting sessions that we're going to be holding, and for coming on time so we can keep the work moving. Please adhere to your usual committee rules of 1 question and 1 answer. Keep them brief. Members of the public will be able to see these proceedings live stream on the Maryland General Assembly website and the YouTube channel. Today, we're going to hear the bills in the following order. And it may change depending, because some of our committee members are actually in other committees with their hearings. But these proceedings are actually recorded. We get to hear it after hours. We also have the files on the bill, so we remove it. We'll review it. So this is the bill order. First, House Bill 1206, Delegate Kerr, Maryland Ireland Trade Commission establishment. If you can come up with your panel, please. Okay, that will be great. Delegate Acevedo, Public Health Healthy Maryland Program Establishment will be number 2, followed by House Bill 619, Delegate Roof, then House Bill 1217, Delegate Adams, House Bill 1486, Delegate Forbes, House Bill 1351, Delegate Howard. House Bill 1501 is the chair of a joint audit and evaluation committee. House Bill 1383, Howard County Delegation. House Bill 1158, Delegates Kerr and Bagnall. And the last bill of the day, House Bill 1327, Delegate Martinez. Again, please keep in mind that this order may change. And we're going to call House Bill 1206, Delegate Kerr. We have a little bit of a time crunch, so we're going to start with that bill. Has not arrived? Okay, so I'm going to call Delegate Acevedo, but please keep in mind that when his witness arrives, because he has a meeting with the governor, I must stop the hearing and then proceed to that one, okay? All right, let's get started, Delegate Acevedo. Public Health Healthy Maryland Establishment.
He's the only witness, so.
And you're the only witness.
I am, so.
All right.
I'm all about making sure that y'all are in and out.
And we're so grateful.
Of course, well, it's one of my favorite committees,
Thank you.
So I'm all about it, all about it. One of my favorite chairs.
Thank you.
And some of my closest friends. I'm kidding. I'm kidding. Just kidding. Just kidding. Kathy and I go back to the sandbox. Okay, well, let me present this let me present House Bill 184 very quickly so that Delegate Kerr is able to also testify as well. Thank you, Madam Chair, members of the committee. This is your friendly neighborhood colleagues just trying to add to your many years of effort to ensure that every Marylander in our state not only has health insurance, but really what the goal is to ensure that we have free healthcare at the point of service as a state. This bill is a reintroduction. As I've said before, and I'll say again, as the richest state in the union per capita, as a state that really can implement a single payer Medicare for all system, we are really the laboratory for public policy when it comes to Medicare for all. I know there are a number of states that have tried to implement a single payer Medicare for all system, and it did not work. States like Vermont, states like California. And the reason why it didn't work is because those states aren't as fortunate as we are to have all of the
Delegate
prerequisites.
Acevedo, can I stop you for a second?
You
We have the
absolutely can,
panel that
Madam
came
Chair.
here. Thank you so much for being so flexible, Delegate
Absolutely.
Acevedo. Let's go
Delegate
to
Kerr, you owe me.
House Bill. He'll get lunch for you.
Right.
We have House Bill 1206, which is Delegate Kerr, Maryland, Ireland Trade Commission Establishment. Delegate Kerr.
And thank you so much for accommodating us, Madam Chair.
You're welcome.
Well, good afternoon. I am Delegate Ken Kerr. I'm here to present House Bill 1206, Maryland Ireland Trade Commission Establishment. So since last summer, Senator Daley and I have been in discussions with the Office of the Secretary of State, with the Department of Commerce, the Secretary of Higher Education, and the governor's staff with the aim of establishing a close relationship between the state of Maryland and the Republic of Ireland, a relationship that will explore our mutual interests and identify and expand opportunities for trade and mutual cooperation. So why Ireland? Well, because Maryland and Ireland are a good match. 1 in 6 Marylanders claims Irish ancestry. That's over 1 million people. And almost half of the United States presidents claim Irish heritage. There are 4 provinces in Ireland with 32 counties, 26 in the Republic and 6 in the North. The Republic being a member of the European Union and the North being part of the United Kingdom. But for purposes of trade, Ireland is a single entity that would facilitate access to both the EU and the UK. A Maryland-Ireland Trade Commission will advance the mutual interest of Maryland and Ireland, including bilateral trade, investment opportunities, joint policy action, business and academic exchanges, economic support, and mutual investment in the infrastructures of the 2 regions. The Commission will be tasked with furthering the trade relation between our state and Ireland, ensuring both are able to economically flourish. The Maryland-Ireland Trade Commission will be within the Department of Commerce, and it will advance bilateral trade investment between Maryland and Ireland. It will initiate joint action on policy issues of mutual interest to Maryland and Ireland, will promote business and academic exchange between Maryland and Ireland, and will encourage mutual economic support between Maryland and Ireland, encourage mutual investment in the infrastructure, and address any other issues that the Commission identifies. So some other points of comparison. Maryland ranked 17th in the economy size with the other states. Ireland is 27th in the world and 11th in the European Union. Maryland is the 9th smallest state, but it's the 18th most populated. Ireland's the 19th most populated state in the European Union. Maryland's the 3rd most educated country in the world, and Ireland's the 3rd most educated in the European Union. We both have major shipping ports connected to freight rail, with Ireland being on the western end of Europe and Maryland being on the eastern end of the United States. The industries of pharmaceuticals, chemicals, computer hardware and software, food products, beverages and brewing and medical devices, financial services, computers, all contribute 29% of Maryland's GDP. Similarly, Ireland's economic focus on pharmaceuticals and medical technology, software, ICT industries, financial services, manufacturing, software, engineering, aerospace, medical devices. These are all industries that are thriving in Ireland. To state it concisely, Maryland and Ireland have a lot in common and a lot to offer each other. A trade commission tasked with exploring potential relationships is a benefit to both Maryland and Ireland, as together we forge a strong economy based on common interest for our people in the future. And there's an amendment, so you all can sign on as co-sponsors to this excellent bill. And I ask for a favorable committee report, and I am so pleased to introduce my expert panel. Liz Chakirla of Sinead Arian, the 24th chair of the Senate of Ireland, Senator Mark Daly.
Thank you, Chairman.
Good afternoon.
Thanks, Ken, and thanks, Chair, for your I suppose understanding that Irish people are always late anyway.
So we have something in common. Dominicans people are always late.
Oh, that's well. Not only are we always late, but we can never understand why anyone else is early, because clearly no one's going to show up on time. But I just want to thank Ken for all his work and all the members on this initiative, which came out of an idea when the New Jersey American Irish State Legislators Caucus came to Ireland, went to Northern Ireland, and saw, I suppose, the impact the United States has had on the peace process in Northern Ireland, because there are people alive in Ireland today because the US got involved, but also stayed involved in our peace process. And what this is doing is looking at enhancing the relationships between our country and Maryland. Not just on business, but on education as well, but also on the governmental links. And, politics, like diplomacy, is a contact sport, and the more times people get together, the more ideas are generated. This year is the 100th anniversary of the establishment of diplomatic relations between Ireland and the United States of America. So I can think of no better way to look at the next 100 years than having something like this initiative in place, so that we can bring Irish companies over here, as they do already. But Ireland is the 9th largest investor in the United States of America, which, when you consider how small we are, is quite something. But we want to be better than 9th. We want to be first. But what we also want to do is look at the opportunities that are there for companies here on partnering with Irish companies, and looking at Ireland as a gateway to the European Union, because since Brexit, Ireland is the largest English-speaking country left in the European Union, a market of 450 million people. 950 US companies use Ireland as their gateway to Europe. And I think that there's a great opportunity in terms of building that relationship into the future. So we look forward to this. Hopefully, I don't think I'm allowed to advocate for the bill, but anyway, in the 10 seconds I have left, and I think we've got to bring in this timing system into our Senate, where we have people kept to 2 minutes, because I got to tell you, it's a hard job trying to keep our. And the time is up. Thank you, Chair.
Well, I want to thank you on behalf of the state of Maryland and the General Assembly and this committee specifically for being here and lending your voice to support this legislation. You are very well represented by the gentleman to your right, who is very loved and respected here. And that's tough. Sometimes you're respected but not loved. And he is both. And he is both. So thank you very much. I'm going to open it up. Would you like to say something?
Yeah, I've invited Michael Patty to join
Wonderful.
us.
Before I open it up for questions, go ahead.
Michael Patty, here on behalf of Gilead Sciences, a biopharmaceutical company who operates in more than 35 countries around the world. As many of you know, Gilead Sciences has a location here in Maryland and also two in Ireland, both one in Cork, employing, and then one in Dublin, employing about 500 some employees over in Ireland, and about another 400 in Maryland. And we're happy to support House Bill 1206 here with Delegate Kerr, and ask for a favorable report. Thank you.
Thank you very much. Really appreciate it. Are there any questions for this wonderful panel? Delegate Alston.
Thank you. So I've been sitting here with the amazing Google machine trying to find a way onto this bill, and I discovered that there is a African American Irish diaspora. And I was wondering, would you be open to adding a member either of the Black Caucus or of this African American Irish diaspora to your study? And could we look at exploring the connections between the African Americans and the Irish community? Because apparently 38% of us have some Irish heritage. And I'd happily volunteer to go on a explore.
I suspect that question's for me because of the legislative angle to it. We were trying to keep this to, the other way of doing this is we could open it up and have 30 people. We were trying to keep it kind of small, but yeah, let's talk about that, Delegate. I'm not opposed to the idea. I just haven't had a chance to process it yet, but thanks for bringing that up.
Thank you. And you spoke about the amendment already that has been amended. You didn't say what it was. Is this the Maryland Department of Commerce amendment that you're referring to?
Yes, I
Okay.
am. I spoke with the Department of Commerce and they requested a sunset
Yes,
for mostly because we want to get started quickly.
yeah.
And so if we have a 2-year window to actually report something and make some progress, I think it will be a much more effective commission if at the end of that sunset period, it looks as if this is a worthwhile endeavor, we can always remove the sunset or extend the sunset. So I do accept the Department of Commerce amendment.
Thank you. We have Delegate Bagnall followed by Rosenberg.
Thank you, Madam Chair.
You're
And Senator Daly, it is an absolute pleasure to see you once again. And it was very exciting to see Stormont when the Parliament returned. I just wanted to ask if there was anything else that you wanted to say when the timer ran out.
Well, I suppose I just want to thank everybody for their work on this. And a lot of this came out of the idea that, states are doing things that previously they weren't doing in so many areas. And as I said, it was New Jersey came up with the idea. And normally, when you have a good idea, you have to ram it down people's throats. But actually, West Virginia borrowed the language of the legislation and passed it into law before New Jersey got a chance to get the governor to sign it. And in fact, we just finished a signing ceremony with the governor of New Hampshire, which became the third state established in Ireland Trade Council. And we have a number of other states looking at it as well. And what we're very keen to do is make sure that we invite people over on a continuous basis, but also now with Zoom and other technologies, exploring the opportunities that are there between the universities, but also the business community. And obviously you have a Guinness factory here somewhere. But it's looking at those opportunities now in relation to Ireland. And I know it's used in Maryland as Maryland being the gateway, but Ireland being the gateway to the European Union, a market of 450 million people. But as Ken has pointed out, that you have also Northern Ireland in this unique position of being a part of the UK and the EU at the same time, which is still working its way through the system. We used to, Chair, when we had some of the legislators over last August, which was the largest gathering of federal and state legislators outside of North America ever, was in Dublin last year. It happened to coincide with the Notre Dame Navy game. I'm just saying that might have been a coincidence. But we did bring them to Northern Ireland, and thankfully the Legislative Assembly in Northern Ireland is back up and running after 2 years of being in somewhat of a let's say, not even a go-slow. They couldn't elect a speaker for 2 years, so they weren't able to sit. But when legislators came from the United States, the BBC had a news report saying that legislators have shown up in Stormont after 2 years of nobody working, but they're coming from the United States. So I think it might have inspired them to get back in action. So thank you for your question.
Well, thank you for your hospitality. We really are grateful. I have another question from Delegate Rosenberg.
Question for the sponsor. Do you know, perhaps it's in the fiscal note, how many other such trade commissions we have that Maryland has? This is clearly not the first, so there's precedent for what you're proposing.
Yeah, Delegate Rosenberg, the only one other I know about is a trade commission with Israel.
Delegate Chisholm.
Thank you, Madam Chair, and for Senator Daley, we have a tradition in this committee of bringing samples of whatever's most reflective of the bill. So since you mentioned Guinness, I was just curious if there's.
I have some Kerrygold butter if that's any good, Chair, but like, I don't think that quite has the same allure as like a bottle of Jameson Irish whiskey.
I like that question. I don't see, Senator, any other questions for you. I do want to say on behalf of the committee, what an honor it was to have you. And you have a home here. You're welcome anytime. And thank you so much for caring about Maryland and our issues. We really appreciate it.
Thank you so much. Thank
We
you.
hope you have a
Great.
blessed day and blessed journey.
Thank you.
You're
Thank you for
welcome.
the honor.
You're welcome. And this actually concludes the bill hearing on House Bill 1206. Let's go next to back to House Bill 184, Delegate Acevedo. Thank you for being so kind and patient. Will you be so kind again and come up? And thanks again. And those of you that are waiting for your bills to be called, we will call them. Be patient. Okay? Thank you. Go ahead, Delegate Acevedo.
Now you got to pass my bill.
Can I just tell you, Delegate Acevedo?
That's the only redemption we're
May I
accepting
say
here.
something? I have not seen this entire session, a bill with a $20.3 billion fiscal note.
Well, you know me.
You think you can get it down, Delegate?
I'm on a budget committee. We're all about spending. Take that up with Ways and Means. You can pose your questions to the members of Ways and
Go
Means. But thank you so very much, Madam Chair, for pointing out the price tag. I appreciate that. Colleagues, again, I'll just be really quick, but I'll point to a couple of things from the fiscal note, since it was alluded to by our very, very good chair. But this bill would essentially establish the Healthy Maryland program, which is which would be a single payer Medicare for all system. For folks who are familiar, there are other states that have tried to implement a single payer Medicare for all system that's state run and implemented at the state level. Those states have not been successful because they have not been as fortunate as Maryland in having some of the prerequisites in order to have a successful single payer Medicare for all system. And so just capitalizing on all of the sort of prerequisites that we have, whether it's waivers to our all-payer system, to just all the legislation that we've passed over the years. Maryland's really uniquely positioned to bring about a single-payer Medicare for all system and ensure that those in our state, regardless of where you live, how much you earn, who you love, where you're from, that you are able to be covered and have the kind of healthcare free at the point of service. I will also point to the fiscal note. They mentioned about small business impact, and this is particularly important because one of the concerns that we continue to hear from small business owners across Maryland and across this country, I know that I share with each and every one of you all our support for our small businesses. Small businesses continue to say that the reason why that they are unable to grow, hire more, pay people better wages is because of the cost of providing health insurance to employees. If we are able to provide this relief to small businesses, to provide single payer healthcare free at the point of service at the state level, we are giving small businesses the opportunity to not just grow, we're giving entrepreneurs the opportunity to move or to act on that business idea or that concept without having to be burdened of figuring out, well, I want to hire, but how do we provide health insurance? How do we ensure that all of our workers are covered and that we're able to afford this? And so this bill is good for small businesses. It is good for working families because we know we still have hundreds of thousands of people in our state who are uninsured. And more generally, it is good for our state and our country because in the richest state in the union, in the wealthiest state in human history, it really is an indictment on all of us that we can't provide health insurance coverage, but really free healthcare, which you know I'm supportive of free healthcare at the point of service. And so the Healthy Maryland Act would do that. As I said in the fiscal note, yes, it's a high fiscal note, and the reason being to answer the chair's question is that this bill does not include any revenue provisions. We did not want to be prescriptive in this bill by saying this is where we're going to get revenue from. This is what we need to do because we are in a tight budget year. I know this as a member of the Appropriations Committee, but it gives us the flexibility to figure out how we can pay for this. And so that is why you see that fiscal note reflected, because we don't have a revenue provision in this bill. But what we do see is the impact that it would have on small businesses. And this is small businesses in your district, in my district, and across this state who we can help by providing a solution to one of their top issues. Again, the Small Business Administration does a survey of small businesses across our country ever so often. And one of the top issues that keep coming back for small businesses is the cost of providing health insurance to employees. So we got to address it. This bill is one of those solutions to address it. We can lead as a state, and I ask for a favorable report, Madam Chair, and I thank you all so very much for the opportunity to contribute to the good work that you all are doing, making sure everybody got good health care in our state.
Well, thank you very much, Delegate, for bringing this bill forward. You know, in an ideal world, right, this will be ideal, right? Unfortunately, it's not what we have, so it is, the fiscal note reflects what it will cost, but it's important to have the conversation. So I definitely appreciate it. I'm going to open it up for questions now. Delegate Lewis.
Thank you, Madam Chair.
You're
Thank you,
welcome.
Delegate Acevero. It's good to have you here in HGO. And I also really appreciate your ideas. This is helpful to actually have the fiscal note. And I'm curious, do you know what we're actually spending now on health insurance coverage in total in Maryland? Because 20 billion sounds like a lot of money, but how does that compare with what we're already our existing commitment?
Yeah, I appreciate that question, Delegate Lewis, and I can answer it as easily as a member of the Appropriations Committee. We spend 2/3 of our state's budget on healthcare. 2/3. Correct. 2/3 of our state's budget is spent on healthcare. And so again, like, you know, we got to find some sort of a solution here. And when we think about you know, workers, when we think about small businesses and the folks who could really use some relief, again, this is what small businesses are saying of the reason why it's hard to start a business, grow a business, scale a business, right? The cost of providing health insurance to employees.
You're welcome. Delegate Johnson.
Thank you, Madam Chair, and thank you for the bill, Delegate, and keeping this conversation going, even though maybe we can't pay for it this year. But my question is, what role do you see businesses playing in helping pay for this? I mean, they have to have, I would think, some role in helping the state make this happen.
Absolutely. And thank you for the question, Delegate Johnson. Businesses do play a role, I think. And this is, again, going back to what I said earlier, in the bill, we don't have a provision on revenue because as a lot of other supporters of this bill, did not want to be prescriptive in saying, well, look, we're not just going to establish this Healthy Maryland program, but this is where we're going to get the revenue from. You got to tax this, you got to tax that in order to get the revenue. We didn't want to be that prescriptive because we wanted the legislature, us, to have the flexibility to figure out how we can pay for this. To your question, I'm sorry, your question was around revenue, correct? Yes. And so there have been some discussion at the federal level, similar at the state level, about payroll tax for businesses who, wouldn't have to worry about offering health insurance to employees, but would have to contribute to a pot or a fund to ensure that their employees and other folks have health insurance. So payroll tax is something that's been discussed, something that we could look at, as well as other revenue mechanisms.
You're welcome. Any other questions? Delegate Olson.
Hello. So it took me a minute to figure out the math on that 2/3. But are you saying we're spending about $42 billion on healthcare right now?
Yeah, so and when I say healthcare, we're talking about hospitals, we're talking about everything related to our healthcare infrastructure as a state. We spend a good bit of our state's budget, I believe it's 2/3 or 3/5, but it is a good chunk of our state's budget that we spend on healthcare, yes.
Yes.
And I was just curious, have you been able to explore how Governor Romney was able to do this, the very conservative Governor Romney, do this in Massachusetts?
Yeah, so important question. So Massachusetts, like the state of Maryland, has an all-payer system, right? And so having an all-payer system, there are a number of ways that you could have approached the issue of universal healthcare, because ultimately the goal is universal healthcare, but you have some folks, when they say universal healthcare, they mean, we want to do everything that we can to ensure that folks have insurance. There's also the private industry that's still active. You also have, programs, government programs, private programs, et cetera. And so in Massachusetts, they did something similar to that. It's not what we're looking at here in the state. It's not single payer Medicare for all. So there's still a private insurance industry. There's still private healthcare, which means that you could run into some problems, whether it's folks not getting covered or deductibles, et cetera, and so on. So Massachusetts went a different route with their idea of universal healthcare, but they have an all-payer system just like Maryland, and they capitalized on that, which I'm hoping we will do as well. But the difference between what we're trying to do here and what Massachusetts has done is that we want a single payer so that everyone is covered. I don't care where you live, what your income is, where you're from. If you live in our state, you pay taxes, you've been living here for some time, and you do not have health insurance, we should certainly find a way to ensure, whether it's through state or government-run health insurance, that those folks are covered.
So just for the record, Massachusetts doesn't have a single payer.
No, they have all payer system.
They
That's
have
what I
like
said. Yeah.
we do, and they actually cover 90-something% of their people, 96%, and they've done a lot of what we have done here, except that they have some extra programs for the very poor, and people that otherwise would not qualify. They allow them to get it.
And I appreciate you just mentioning that, because like I said earlier, they have an all-payer system just like us. They just went a different route.
Yeah.
Yeah.
No one has done it, has been able to do it in the United States.
Some have tried.
Yet. Some have tried, yes.
But those folks, those states are not as fortunate as us, like Vermont and California. They don't have the waivers. They don't have the things that we got, so.
Because we have, we're unique with everything that we do as well. Delegate Gazzoni.
Thank you, Madam Chair. I was just curious, I see in here up at the top that it says that establishes the program as an instrumentality of the state. I worked as at an instrumentality of the federal government, and we got like almost no appropriated money. It was all self-funded. So could you explain how the instrumentality piece of this works?
So this would be a state program, a state agency that is developed that would have dedicated funding, and that is something that we can look at. As I said earlier, I didn't want to be prescriptive with this bill when it comes to revenue and when it comes to mandated appropriations, because I wanted us to have, again, the flexibility to sort of figure out where we get the revenue from to pay for this and appropriations. But it will be a program that's, as the bill mentioned, that's an instrument of the state. There are a lot of agencies, there are a lot of programs that are instruments of the state. And to your point, Delegate, you're right, that don't always get funding, but that's not the goal here. And the reason why we didn't, expand too much on that in the bill is because, as I said, we didn't want to be prescriptive, right? But yes.
Okay.
Hopefully I answered.
For instrumentality of the federal government, and it was like what we got appropriated money for was auditing. Otherwise, it was a completely self-funding process. Like
I see.
we operated in cash, not appropriated money.
Hmm.
So that's why I was curious how this was going to work if there was, I mean, presumably we'd still get money from the feds, but otherwise my sense would be that language would mean that the state wasn't necessarily putting money in.
No, good question. And I'm happy to, just talk a little bit offline. I'd love to hear your experience from, the agency and make sure that that's not the case here. But I don't think that was the intent with that, but I appreciate it. Thank you.
Okay, I see no other questions. Thank you so much, Delegate, for being with us today.
Thank
We really
you all.
appreciate it. This concludes the bill hearing on House Bill 184. Next, we have is Delegate Ruth here? Yes. Delegate Ruth, Public Health Commission on Universal Care.
Thank you, Madam Chair.
You're welcome.
I'm feeling pretty good about my $250,000 fiscal note right now.
It had to be 100,000. It's still too much.
Madam Chair, Madam Vice Chair, members of the committee. Seriously, I really appreciated the robust discussion about the cost, because as I think came out in this discussion, we're not talking about whether it's $20 billion or whatever it is. It's not $20 billion added on to the budget. It's replacing what's already being spent on healthcare. And we're talking about a whole different system when we talk about universal healthcare that would have its own set of revenue, possibly payroll tax as was discussed, but possibly something else. And we also, when we talk about universal healthcare, achieve a huge savings from administrative costs, from not needing to have all the complexity of billing of different insurers who have different systems and different processes. And so all the analyses that have been done, and there have been some state level analyses, including in Maine and in New York for the New York Health Act, which show that a single payer system can overall save money for the state, for small businesses, as Delegate Acevero said, for individuals. And also I would mention cities and counties as well, who have to insure their employees as well. And there have been several counties and municipalities in Maryland that have passed Medicare for All resolutions, including Annapolis, Frederick, Anne Arundel County, Prince George's County, and Baltimore City have all passed resolutions calling for Medicare for All. So my bill, and for the record, I'm Delegate Sheila Ruth, and I'm here presenting House Bill 619, is a commission to study for the formation of a single payer universal healthcare system. There's a lot of complexities, as we can see from this discussion, that need to be worked out. The cost issues, things like how to integrate all the federal money that we have coming in, Medicare, Medicaid, federal employee, how to deal with ERISA, which is, says that we can't require, states are prohibited from dictating employee healthcare benefits. I'm sorry, I couldn't say that right. So there's a lot of complexities that have to be worked out, which is why my bill is a commission that would study how to accomplish that, what the costs would be, looking at some of these analyses that have been done in other states and at the federal level, and really just start to figure this out. I did retool the commission this year from previous years, kind of simplified it, made it more of a traditional commission, whereas before the commission was charged with developing a plan, I think that might be putting the cart before the horse. So the first thing that this commission does, their goal is to develop recommendations, and there's an interim report and there's a final report. And then if we were as a body to decide we wanted to move forward, then the next step would be to develop a plan. So this is sort of the first step. And so there's a lot of information out there that can be looked at, but the commission would have to look specifically at how this would be implemented in Maryland. Now there's critics who say it can't be done at the state level, and people point to Vermont because Vermont tried it and they kind of backed out from it. And Vermont has a very small population. Maryland has a population of 6 million people. And for comparison, New Zealand has a million less people, million fewer people than we do. And they have very successful universal healthcare system. So there are, many reasons to believe it can be done at the state level, but we're not asking the state to commit to it. We're just asking the state to do this commission and to really, look into all the different options and how we could make it work. The commission also is charged with considering healthcare equity and how to reduce healthcare disparities, how to increase access in underserved urban and rural areas, because I know a big issue is the rural areas. There are not, enough doctors. There's not enough medical professionals anywhere, but I've spoken to people like on the Eastern Shore who have to come across the bridge to get medical care. So I think that's important to look at. And as I said, the commission would not be starting from scratch. They can be looking at other work that's been done. And they're also charged with issuing recommendations on transitioning workers who would be displaced by the change. So this committee and the state in general has done a tremendous amount of work in making sure that everybody has health insurance. And I applaud you for that. And we have, including this year with the Access to Care Act, which hopefully is going to get through, we have done great work. There are still, I believe, several 100,000 people who don't have health insurance, but there are also many people who have health insurance who can't afford to pay the out-of-pocket expenses to go to the doctor, so they delay care, which leads to worse outcomes, which also leads to people going to the emergency room, which contributes to our emergency room wait times. So this commission is the first step in protecting the well-being of all 6 million of us, and I urge a favorable report on HB 619.
Thank you, Delegate Ruth, for your leadership on this issue. I see Delegate Hill.
Chair, thank you, Delegate Ruth, for your persistence and your thoughtfulness in trying to get us to move forward. Is it fair to say that as you see it, we're sort of heading down a road that's going to get, even as we cover more and more people, that's just not sustainable, and we can't look for alternatives if we're unwilling to look, that we can't see better options if we're unwilling to open our eyes and look?
I think that's a great way to look at it, that the system, the costs go up, there's the fragmentation, there's yeah, I mean, I think that's a good way to put it. And we do need to look at alternatives. And if we don't look at alternatives, we're stuck, right? Thank you.
Welcome. Delegate Woods, followed by Lewis.
Thank you, Madam Chair. So a couple of things. I'm wondering, do we know of other states who have done studies or commissions? And do we have a number? And then to piggyback on what Delegate Hill was asking, I forgot what the piggyback was.
If we don't do it now.
No, it was,
Is it sustainable?
Oh, it was okay, I'm sorry. To piggyback on what Delegate Hill was asking, if we're talking about a replacement, technically what we currently have would also go up with an increase in numbers, correct?
I didn't understand
I'm
second part, sorry.
Delegate Hill was talking about increased expenditures because of, additional people who would be being covered, right? I'm saying right now, currently, as our budget stands, it would increase with an increase in numbers also, correct?
Yes, that is correct. Thank you. And, and it's not just the cost and also to it being unsustainable. I understand doctors spend hours on the phone with insurance companies, hours, and you probably know better than anybody. And, if we have a single payer system where everybody just goes to the doctor and, the doctors get paid and they don't have to try to, beg for their patients to get the healthcare that the doctors know that they need, and they don't have to deal with the billing issues and all of that, that gives the doctors more time to spend with patients. In reference to in answer to your other question, there have been analyses done in Maine, and Maine actually has passed a single payer universal healthcare system. The problem is their system doesn't go into effect unless the federal government creates waivers for Medicare and Medicaid, I think. So, and right now that's not likely to happen anytime soon with the federal government the way it is. So, if those waivers are created, main system goes into effect. So they do have an analysis that shows a single payer healthcare system would cost less per person, would cost the government less overall. There is also one in New York done by RAND for the New York Health Act, which, by the way, the New York Health Act has passed the Assembly 4 times. It just has never gotten through the Senate, something I think we can all sympathize with here. And so the RAND analysis says, very similar things, that overall it would save money. And while there are, need to have payments, when you look at it overall, most people are going to save money and most businesses are going to save money. And that's what the study says.
Yes.
It's just more of a comment than a question, but isn't it true that not only do doctors spend a whole lot more time themselves, but they've actually had to hire people to try to help get some of these, literally had to hire people full time. Isn't that correct? To try to help get some of these approvals?
Absolutely. Thank you.
You're welcome, Delegate Lewis.
Thank you, Madam Chair, and thank you, Delegate Ruth, for your bill and for your persistence. I see the value in a commission and a work group in an effort to study the options and implications of universal coverage. I'm curious, though, how you would respond to opposition testimony that we have from a couple of sources, one being the League of Life and Health Insurers. And I don't see their representative here today. So if I may just let you know, the health insurers oppose the bill because they say the private insurance market offers more choices, offers more better services and better value. And I wonder how you would respond to that. Your bill proposes a study. It doesn't propose a replacement of private insurance. Is that correct?
It does propose a study, but I would also say more choices means more complexity, and that adds to the cost, where when you have all these different plans and some of the plans don't cover very well and some cover very well depending on how much you're willing to pay. And so the choices that you have make it complex to lead to the situation where doctors have complexities and billings and the cost that's associated with that. And I don't know that I'd agree, though, that it provides more value, because what's the value of somebody just being able to go to the doctor? They don't have to figure out what health insurance is right for them and sign up for it and then figure out which doctors are in their network and whether their procedure is covered. They just go to the doctor. How is there anything that has more value than that? But yes, Delegate, thank you for the question. And this is just a study which would look at all of those things. And
You're welcome. I don't see anyone else. Thank you so much,
Thank you.
Delegate, for being with us. You do have someone on your panel, and that is Mr. Ken Phelps. Yes.
Madam Chair, Madam Co-Chair, members of the committee, good to see you again, first of all. I said a couple weeks ago when we were talking about access to care, and congratulations on passing that, by the way, that was great.
Thank you.
That the Episcopal Church, and we appreciate the opportunity to weigh in, really embraces universal health care as a fundamental human right, along with housing, with food security, with education. And the indictment that Delegate Acevero mentioned a few moments ago is really one that we have taken those human rights and have so commodified them that the cost is becoming prohibitive, and it is crushing our people, basically. So I serve a small parish, and I tell you that the money that goes out the door trying to help people pay rent or to buy a prescription or to get food, it's just coming at them at all angles. And so we come at this as a way of saying this is a way of providing, some relief for them, some relief. Just anecdotally, I also have a confession to make. I'm a priest. I'll confess something to you. We would really, 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 really like to see you pass Delegate Acevero's bill. But if you're not as bold as Jesus, there's this one. So we would urge, we would urge a favorable, outcome on this. But we would really, really like to see 184. And if I might, Delegate Ruth, just to add, I went on leave from call from the priesthood for about 5 years. I worked for an insurer. And where's the value in their boast not being the care they gave to their members, but that they had a 30% return on shareholders' equity? Corporate sin. I'll leave you with that.
All right. Are there any questions? Seeing none, thank you very much. Really appreciate you always. It's great to see you. Thank you. They said it's best to be seen, not viewed, so definitely. This actually concludes the bill hearing on House Bill 619. Next, we have House Bill 1260, Delegate Adams and Hutchinson. State government permits, licenses, and certificates reimbursement.
Thank you, Madam Chair, Vice Chair, committee members. For the record, Delegate Chris Adams here to present House Bill 1260, as you said, titled State Government Permit License Certificates Reimbursement. The legislative intent of the bill is to say if there is a court order or final determination that a license permit of fee is deemed unconstitutional, that fee will be reimbursed to that fee to that permit license or certificate holder. The bill is pretty simple to explain. So the policy decision that you're making is whether or not, if that court adjudication happens, does that holder have a right to have the money back? You may ask as to what the rationale behind the bill is, and I'll point you to the fiscal note where I'll read that the Department of State Police advises that the U.S. Court of Appeals for the Fourth Circuit is currently considering litigation regarding the constitutionality of the state's handgun qualification license. The state police further advises that as February 2024, there are 318,444 HQLs issued in the state. So the bill, I'd ask you to move favorable and to consider the policy ramifications if the courts make a determination like that. Thank you, Madam Speaker, or Madam Chair and Vice Chair.
Thank you very much. I'm going to open it up for questions now. Are there questions for the delegate? Delegate Alston.
So are you saying under this bill, if I pay for HQL, I could get my money back if the court holds that it's unconstitutional?
That's exactly what this bill does.
What would be the limitations? Because that would be ungodly expensive on the state.
Well, the fiscal,
considering how far back would it go?
The fiscal note says that if that were to happen, that it's $15.9 million that would have to be paid back in the form of general fund expenditure.
Any other questions? Seeing none, thank you, Delegate, for being with us today. Oh, I'm sorry, I didn't. Two, did I miss two? Okay, Delegate White-Holland, sorry.
Yes, thank you, Madam Chair, and
You're
thank you,
welcome.
Delegate Adams, for being here in your testimony. I was wondering if you could speak to the letter of information from the Board of Physicians, if you could expound upon that as they relate to and saying that as all fees are set at a rate to cover the cost of maintaining the board's operations, any reimbursement could lead to a negative operating budget for the board and potentially impact their ability to conduct investigations and protect the public. So could you expound upon that and speak to their letter of information?
Yeah, sure. Well, my thoughts on it is that's more of a letter of curiosity. They're like curious, where's this bill coming from? Because in their letter, they're stating, well, we're not sure where we would ever have one of our licenses ever be deemed unconstitutional. But if it happened, here are our concerns with the bill. So why don't I just adopt their position, which is that I doubt seriously that there are any of these licenses that are ever going to be rejected through a act on par with what's happening with the HQLs, which is a serious matter for citizens in my district. And I think it's a worthy policy discussion for the committee.
Okay, thank you. Anyone else? All right. Oh, Delegate Lewis.
I am getting questions on this.
Oh, there you go.
I wasn't sure.
Thank you, Madam Chair. Thank you, Delegate Adams, for your bill and your testimony. I had to look up what an HQL is. I don't even know what that is. So I did that. One of the greatest things about this job is you're always learning, right?
Yes.
So when I did that, it occurred to me that I was trying to think what an analogous situation might be. The state basically taking a or declaring that, a handgun license is no longer approved. And it occurred to me the clearest analogy I could think of would be the impoundment of a vehicle for unrenewed license or something. And the state has the authority in law to confiscate vehicles, impound them, maybe not return them if the owner of the vehicle, the license holder, hasn't fulfilled whatever requirements. And then I asked myself, well, if the state can take someone's vehicle, should the state then be responsible to compensate the license holder, the vehicle owner, for the impounded vehicle? And if that were the case, that would be a model for what you're proposing here. And I'm just wondering if you had those implications in mind.
So my response to that is I would not view that as being analogous, because what my bill's doing is saying very specifically, if there's a court decision that deems a license, permit or certificate to be unconstitutional, that at that point in time, the fee would be reimbursed. So your scenario is more of the state taking personal property, and then can that be similar to what my bill's doing? Now, that might be a different bill, but I don't think it's this bill.
Yes.
Yeah.
Thank you for explaining that. And you're right. I get it now. See, this is interesting stuff. So, okay, a better analogy might be something like revoking a license to practice. So that's something we deal with a lot in this committee, licensing for health providers. So let's say, for example, the state, which has the authority to do so, revoked a physician's license to practice that would, or called their license, I don't know, was fraudulent, or and somehow they weren't able to continue working under that license. Would the state then be required to compensate that physician for lost income, for investment in education, et cetera?
The answer is no, for the same reason I gave you on the last example. I'm in the bill, and I'm pulling the bill out. We're talking about a department, an independent unit, a unconstitutional license requirement. So these are definitions within the bill. So unless your example includes unconstitutional license requirement, then I don't think any of the examples apply. I wouldn't want to get into a conversation about revocation of licenses, whether that's for cause or not cause, or whether or not somebody should be reimbursed for that. My bill has a fairly clear legislative intent, and it does relate to if a court deems something unconstitutional, that the state of Maryland should reimburse the license holder the fee.
You're welcome. Delegate Chisholm, followed by Alston.
Thank you, Madam Chair. So I just want to make sure I've got this right. In summary.
I was pretty sure
in
that I wasn't
summary,
going to get any questions on this bill, but
the state of Maryland.
If I may, this is a committee that engages.
I love engagement.
Sometimes all it takes is one light. And then
Yeah.
in summary, the state of Maryland passes a law that then requires a license, and then a higher court or even a court out of the state of Maryland says, no, this law is unconstitutional. You require these people to get a license, but it was unconstitutional for that law to be passed. The state of Maryland would then owe them the money back. Am I correct on that?
Are you asking me as it relates to this bill? Are you summarizing my bill for me? Is if you're in a court of law and this HQL, and I'm just going to stay on what the subject of the bill is, and the courts determine that license is no longer valid, okay, under that very limited and direct circumstance, we want that money reimbursed back to the person who held that license.
Because they were made to get that license and it was unconstitutional.
They were, okay, so right now we have the ability to get this license, okay?
Right.
And through the action of the state, and through the court, there's a final determination, right? So if there's a final determination, we're saying that the state has an obligation to, this is a policy question, has an obligation to reimburse that fee to that license holder. Absolutely.
Delegate Hill.
Thank you. And thank you for the bill and thank you for being here.
Okay.
Do you know where the fees go? How they're utilized?
Well, I believe the answer, it goes to the general fund, but
That's
I'd have
good.
to go to the fiscal note and confirm that.
Okay. And do you, doesn't some of it go to actually do the background checks? So there are fees for the background check, or fingerprinting fees? What fees are which fees are we talking about?
You know, I'm sorry, I don't know the answer to that, but I can get back to you.
Okay, and so when you do, I guess the question is, since there was work that went into it, would your bill mean all the fees would come back, or since the background fees went to actually do the background check, would those fees not have to be reimbursed because there was actual work that actually paid for something to be done?
No, I want all the fee to go back to the holder of the license in this scenario, 100%. Whatever's happening right now in the courts, if it's determined that license is no longer valid on constitutional grounds, I want that money, every penny, to go back to the license holder.
Was considered constitutional by a previous court?
The fiscal note says that we currently have 318,444 HQLs. And I would fully expect, if you pass the bill, to have each one of those license holders reimbursed for their fee.
Are issued when it was considered constitutional to do so, they should get it back. And then if another court finds again that it's constitutional, they owe the money back to the state?
Well, okay, so you've asked me a question. I need to have you restate it.
Okay.
Because I'm not sure I.
So
got it.
some of those licenses, I presume, were issued 20 years ago, 15 years ago. And the courts, the constitutionality issue has been in flux. So I'm asking if a license was issued prior to the current state of law that says, or there's a question of whether it's constitutional to do so, would those fees also have to be reimbursed, or only the ones that were paid after a finding of unconstitutionality?
Okay, on the bill that I have before you, if there is a final determination by the court that these HQLs are no longer constitutional, right? It doesn't matter to me the number, and it really doesn't matter to me when they were issued. We believe that the fee be reimbursed. That's the intent of the bill. You can amend the bill once it's in your hands how you wish, but that's the posture the bill's in right now. You're welcome.
Thank you. All right. No other questions. Thank you so much for being with us, Delegate Adams.
This was engaging. Thank you very much.
This actually concludes the bill hearing on House Bill 1260. Let's go to House Bill 1486. Delegate Forbes, Economic Development, Cyber Maryland Fund and Program Alterations. You have Troy Lemele Stovall with you. I hope I pronounced your name correctly. Oh, this is sponsor only? Yeah, it's a rule bill. This is sponsor only, but if there are questions, will your panel be able to answer it? How's that?
Absolutely. Thank you. Thank you, Chair Pena-Melnick, Vice Chair Cullison, members of the committee. For the record, I'm Delegate Kathy Forbes for testimony in support of 1486. Last year, in its great wisdom, the General Assembly passed SB 801, which created the Cyber Maryland program within TEDCO. The Cyber Maryland program will create a talent pipeline in cybersecurity and serve as a hub for the state workforce development in the field of cybersecurity. The bill before you today was requested by TEDCO, and it's necessary to amend the language in the original bill to allow the agency's staffing flexibility. This change will also make the language in the administration of Cyber Maryland program more aligned with other programs that TEDCO administers. It's a small change, but requested by TEDCO. And the original bill will be able to be administered in the spirit it was intended. And I'm happy to answer questions, and I ask for a favorable report.
Okay. Are there any questions for this panel? Okay, And sir, you are in Me Too?
Yeah. Yes, ma'am.
Okay,
Troy is the head of TEDCO.
okay. All right, and in one sentence, tell me why you want this bill.
Again, Delegate Forbes summed it up well. It aligns, so it aligns the language of our other programs at TEDCO, so we can administer it very similar to the way we do it at TEDCO already.
All right, thank you very much. All right, thank you for your testimony. That was sweet and easy. All right, this actually concludes the bill hearing on House Bill 1486. And next we have, is there someone here for the Joint Audit and Evaluation Committee? Okay, all right, so let's do Delegate Howard. Yes, please, thank you. So I have, you have your panel with you? You can pull up a chair, please.
Okay.
Thank you very much. Whoever is on your panel, just pull up a chair and come up. And you can share the microphone right there to your right. Thank you, everyone, for your patience, and you may get started.
No, thank you, Madam Chair, Vice Chair, colleagues. Great to see you. For the record, Delegate Howard, pleased to present HB 1351. You know, there was a little talk about persistence, and that's why this bill is back. I'm very, very pleased to be back in front of the HGO Committee today. This bill requires insurers, nonprofit health service plans, and health maintenance organizations to provide specified coverage for long-term antibiotic treatment of Lyme's disease and any related tick-borne illnesses. I'm very, very happy to be joined with a great panel today. I want you to pay special attention. We've also talked a little bit about fiscal notes, and I would ask you to please take a look at the fiscal note. There's really not much of a fiscal note with this bill. And I would also like to pay special attention and introduce a good friend of the General Assembly, and that's former Senator James Brochin, who's here with me today. And with that, I'd like to kick it off to my panel, if you would, Senator.
Thank you, Madam Chairman. Madam Chairwoman, it's a pleasure to see you.
Nice to see you. Long time no see.
Yeah, it has been. Members of the committee, long before I was a senator, I was a tennis pro. And one weekend I was teaching and I got bit by a deer tick. And I got gravely, gravely ill. I started sleeping about 20 hours a day, had massive headaches, and suffered major short-term memory loss. At the time, Lyme disease was fairly well known. And I went to the doctor, a Johns Hopkins physician, who diagnosed me and prescribed a 2-week antibiotic treatment. As I was on it, I was reading more and more about Lyme disease, and I had read that you needed a longer term. My physician, who I thought was great, and he was great, except in this area, said, no, 2 weeks is fine. You'll be fine in 2 weeks. So I went off the antibiotics after 2 weeks, and within 72 hours, I got full-blown Lyme, like worse than before, where I lost about 25 pounds within a 3-month period and went back on antibiotics within a week and was on antibiotics for 2.5 months. The spirochetes that are in Lyme disease are the spirochetes that are in syphilis also. It was incredibly debilitating, the sickest I've ever been in my life. And I was terrified to go off of them because when I went off of them, I thought I was going to be a goner because, the resistance had increased because I was on them and then went off, and the spirochetes and the disease became more lethal. I put this bill in 15 years ago and watched in my committee. I was on EHE at the time. I watched hundreds and hundreds of Marylanders from the shore in Western Maryland and other places tell me story after story, the story that I've just told you, have their doctors prescribe things like ibuprofen and other things and not understand the disease. Unfortunately, in my 2.5 months, I had to pay the full ride for my antibiotic protocol.
You can continue. Go ahead.
Thank you, Madam Chair. Because the protocol was the same then as it is now, which was 2 weeks the insurer pays, and that's it. The irony of the whole thing is antibiotics aren't that expensive, and the antibiotics that treat this are not expensive, but are effective over the long term. At the time, we had a physician, Dr. John Alcott, which I'm sure I'll probably send in testimony from Johns Hopkins. I don't know a physician like Dr. Alcott or any other physician who will tell you that a 2-week antibiotic treatment will cure Lyme. Lyme disease is curable. I got really, really lucky, unlike a lot of Marylanders. After 2.5 months, losing a ton of weight, and having short-term memory loss for about 2 years. It took me about 2 to 3 years to recover after I went off the antibiotics. I fully recovered. But other Marylanders aren't as lucky. This bill is smart. It's timely, and I'm hoping it'll be passed, and it will only benefit Marylanders. So thank you very much.
Thank you, and I'm glad you're doing well. And
Thank
thank you for sharing your story with us. We appreciate it.
Thank you, Madam Chair.
Next, you're welcome. Next.
Hi. Imagine that you're getting ready for work one morning and getting ready to check on your daughter to make sure that she's up for school. It's the day after Halloween. She was out trick-or-treating and up late. You hear a thump and just assume that she dropped something. Then you realize that what she dropped was herself. She's unable to get up, unable to walk. You carry your kid, who's a teenager, so the same height as you, down 2 flights of townhouse steps to go to Annapolis Pediatrics. They bring a wheelchair to get her inside, and her pediatrician makes an emergency intake visit for your daughter at Arundel Lodge for a psych eval, because clearly she's making this up. This is just the beginning. Countless doctors, the best hospitals, University of Maryland, Hopkins, specialists, no one knows why she can walk one day and not the next. 6 months go by between all the doctors and endless nights trying to figure out what's wrong with your daughter. Finally, you find a doctor who knows what it is and that it can be treated. Unfortunately, they can't take insurance. The bacteria burrows in the tissues and joints, it hides, and it can come back. I have a 16-year-old who misses school for a week or two at a time. She uses a cane or a walker. She's 16. She can't hang out with her friends because of the excruciating pain, as the Lyme has burrowed into her bones. I have a 16-year-old that's also determined to be a Lyme doctor and help kids going through this. Had the Lyme been found immediately and a full round of antibiotics, it could have possibly cleared it up, or at the very least lessened the load that her body had to fight. Enough wouldn't be covered by insurance because the life cycle of the Lyme bacteria is 28 days. Everything needs to start somewhere, and this bill is just a beginning. The financial burden that comes with Lyme, once it's in a late stage, is tens to hundreds of thousands of dollars, not to mention the toll on mental health. In the last 2 weeks alone, I've spent over $3,000 on treatments for her. Having to choose between treatment and living with the Having to choose between treatment and living with the disease that's causing damage to the rest of her body is crazy. But the average person doesn't have thousands for treatments, if they can even find a Lyme literate doctor. In closing, we know that long-term antibiotics may not be the solution, but they can give doctors an opportunity to pulse antibiotics, or at least provide someone a fighting chance and lessen the load that their body has to take on, giving them an opportunity for their body to fight off the disease. Anyone with Lyme who's lived this story knows that this alone isn't enough, but we have to start somewhere. Don't let anyone else's family go through this pain that my daughter lives with daily. This could be your loved one.
And I'm so
Thank you.
sorry that you have experienced that, your daughter has experienced that in your family, and the committee thanks you for sharing it with us, okay?
Thank you.
You're welcome. Next, please.
Hi, my name is Brianna Lapp. I'm a 16-year-old suffering with chronic Lyme. I have 2 forms of Lyme disease active now, and I have suffered with other co-infections like Babesia and Bartonella. I have never publicly spoken about my illness because it's not really medically recognized, but today will change that. These diseases are spectacularly difficult to kill. That's the whole point of their existence. They have adapted to their environment to be able to resist the predictability of medications like doxycycline. This is an example of bacterial persistence, which is a phenomenon noted in many other diseases such as E. coli, and this phenomenon is also widely documented by the NIH. A week or two of this medication does not necessarily kill every toxin, especially if the case is chronic. 7 to 14 days of doxycycline is what is covered by insurance now. 0 studies show that Borrelia, the causative agent of Lyme disease, can be fully eradicated from the body, according to Project Lyme and the New England Journal of Medicine. Project Lyme also says that, quote, an abundance of evidence to suggest that B. burgdorferi, the causative agent of Lyme disease, can persist against the CDC's currently recommended antibiotic treatment, unquote. I have no savings for college or a car because we have had to use all this money for my health. Many people can't even afford the treatment and just suffer, so I'm one of the lucky ones. I want to go to medical school to help people also afflicted with Lyme disease or diseases similar, as it's extremely difficult to find a doctor who's Lyme literate in the first place. I see every time I get a Lyme treatment that the cost is high as well as not covered whatsoever by insurance companies. People need to recognize that Lyme is a relatively common disease and will not be dying out anytime soon, and the passing of this bill is crucial to ensuring Lyme disease is not ignored. These symptoms are real and persist, as does the disease itself. What about people who can't afford treatment? Should they just suffer? Treatment should be a privilege, should not be a privilege. It should be a right. Thank you.
I want to thank you for opening up to the committee and for sharing your experience. And I'm really sorry that you had to endure that.
Thank you.
And I loved how you gave your mom, you held her hand. You know, that was very beautiful. Thank you for being with us today.
Thank you.
You're welcome. Next, please.
Good afternoon. My name is Tracy O'Riordan. Thank you all for having us here to hear our stories today. I'm 52 years old and I've had Lyme more than half my life now. I've been in Maryland only 33 years though, but I've had Lyme 27. I acquired it in Crofton while I was sleeping in bed in less than 6 hours. So the CDC 36-hour timeline is thrown out the window. It took over 16 years for them to diagnose me correctly. I had doctors literally say they give up, go away. When I finally got the diagnosis, yay, my daughter and I, and we thought our troubles would be, over, we would get help, but no, the only help we could get was from doctors who didn't take insurance. So we had to pay cash. We paid over $70,000 in less than a year, the first year. It ruined my marriage. It ruined my savings, my bank account, my entire life. I currently am homeless. Up until just before Christmas, I was living in a tent in the woods. 52 years old. And I've had Lyme disease a long time, and it is killing me. It has caused me to have a heart attack, a stroke, seizure disorder, so I no longer drive. I had to get rid of the truck I was living in because I couldn't drive it anymore. And the tags expired and I had no money. I barely have money to eat. I could be a functioning member of society, but now I'm not. I'm a drain. I'm on Medicaid, food stamps, Social Security. I get $600 a month total. And I take more than 20 prescriptions, and that's through mainstream doctors who really don't know Lyme and what they're doing. Please come help us. William Donald Schaefer declared May Lyme Awareness Month in 1995. What have we done since then? Help us now. Thank you for your time.
Thank you for sharing your story with us, and I'm sorry that you have had to go through so much, okay? But your voice matters, and we're grateful that you're here. Okay. I don't see Delegate Hutchins. Oh, I did. Thank you for looking out for him. I just need to train my head. Delegate Kipke.
That was funny.
Yes, you are.
All right, then. Go ahead.
Thank you, Madam Chairman.
You're welcome.
And thank you all for telling your stories. I've witnessed it with a loved one, and I know it's very serious. And I know it's been very tough on all of you. And Senator, it's good to see you back. I'm not going to ask you if you miss us, but I miss you.
Thank you, Delegate. It's very nice going to sleep at night and not thinking about anything and waking up the same way.
I'm very interested in. One of the things I love about this committee is people call us asking for help with things, and especially around healthcare. And oftentimes we know the right people to talk to. And I had someone who's was diagnosed with Lyme and was being denied coverage. And the health insurance company came back and said, kind of in a whisper, if we have the doctor listed under fibromyalgia, the treatment would be covered. And that's what the doctor ultimately did. And the lady, she recovered. And so I guess there's ways to get around the black and white protocols, but I'm just curious if there's anything more you want to elaborate on out of respect to you and your situation. If there's anything that you want to elaborate on related to the treatment protocols and ultimately how you found recovery.
I think the witnesses did an incredible job. And I think that the common denominator between them and myself is that there's a window of when you can get treated effectively and when you can't. And I see heads nodding. And like I said, I'm the lucky one here. I was diagnosed within 2 weeks, and it wasn't just the bullseye, which I really didn't see. I also got a rash that started out that big and then became that big and bigger with some incredibly awful symptoms. And then got diagnosed within 2 weeks and then was able to, even after, not being on antibiotics long enough, I had a fighting chance. These brave witnesses didn't have a fighting chance because of the diagnosis issue. And I can tell you, I got Lyme disease in 1986. And the stories that I heard from patients across the state of Maryland and the stories that I hear today about physicians' lack of knowledge about the disease is frightening. We haven't made the progress in education about this window where you have this opportunity to effectively treat this. But as they've articulated, and the very brave young woman articulated from the New England Journal of Medicine article that she talked about, 2 weeks doesn't do it. And it's not even close. And there's no way that people should be spending their college tuition money and other stuff for an antibiotic. And this is important, an antibiotic that is not expensive. In my other life, when I was in the Senate, and my full-time life now, I'm an insurance broker. So I represent companies and their employee benefits, healthcare. And I can tell you there are drugs out there for MS and things like that cost $14,000 a month. We're talking about, $140 a month. I know that some people are a little squeamish when it comes to mandates and health insurance mandates. But we're talking about a drug that an antibiotic like doxycycline, which is so inexpensive, and the debilitating effects and the drain on Medicaid in this state as a result of what's going on here, that it's not even in the same equation.
Okay. I'm now going to the right. Delegate Hutchinson.
Thank you, Madam Chair. Perhaps for the delegate or whoever you choose to answer it, I'm trying to understand what the problem is that we're trying to fix here, because I see one from the letter, from the health department that long-term use of antibiotics is harmful. Then I see the letter from the payers that they're not going to pay for it. Is this both? Are we trying to fix both here?
In the short answer, all that in the round is yes. I mean, I've had conversations and there's no solution brought to the table. I had a conversation yesterday. There's just no solution brought to the table. I brought prior legislation that talked about extending these antibiotic treatments, and there's just no solutions brought to the table, whether it's through the insurers or through the health director and who I talked to yesterday. It was just kind of like, well,
So just to follow up on that, today, I think on second reader on the floor, we had House Bill 676.
you're talking about the right
to try.
Yeah, exactly.
Is that, in your mind, what you saw today and what you know from Delegate Morgan's
I
bill?
gotta be honest with you. I mean, it feels like that the General Assembly has an appetite for this type of legislation based on that legislation. I didn't want to kind of call that legislation and talk about that legislation here before this committee and this bill hearing, but I think you're 100% right. These folks have Lyme's disease. They know 100% with 100% accuracy the negative impact it has on their lives, and they know the medical risk on long-term antibiotic treatment, and they're willing to do it. They think that it's worth it, both fiscally and personally, as far as their body is concerned. And I take them at their word and they're willing to do it. And quite frankly, there has been no other, like I said, I was on a Zoom meeting yesterday and looking for some type of common ground. It's 14 days. Can we go to 28? Can we go to 45? What can we do? And there's just been no real alternative answer offered. And that's why we're in front of the committee yet again. I kind of quipped when I walked up to the table talking about persistence. And that's why this legislation's back again, because of these stories. And they are 100% factual, 100% real. And because the lack of action, both in the insurer community and from the health community.
Just one more follow-up. So when did the first time somebody realized this long-term use of antibiotics is actually effective, or who tried it? How did it first come out and say, let's keep going on it, it'll help?
Willie Bugderfi.
Yeah, I mean, you and I, Tracy, you and I have talked about, or anybody want to answer up? I mean,
Only
I
one
believe
person
it
can
was
answer.
Dr. Willie Bugderfi.
I'm sorry, Madam Chair.
One person can answer.
Yes, ma'am.
I believe it was Dr. Willie Bugderfi, which half the Borrelia Bugderfi is named after. He discovered Borrelia. He did a lot of research on it, of course, because Borrelia has been around for millions of years, right? But when you mess with it and it changes, it mutates, then you're left with us. And not one of us can be treated exactly the same. The antibiotic treatments and other treatments have to be altered depending on the symptoms of each individual person, because each person can get infected with somewhat different strain of Lyme, plus co-infections such as cat scratch disease. All of that still has to be treated, and none of it is covered by insurance companies, especially if you go to a Lyme literate doctor and they write the prescription. We need to be able to have our talks with our doctors and let the insurance companies just pay for what our doctors recommend for us individually. It's our choice. We're making that choice. Most of us are knowledgeable by now with the internet. I'm on it all the time. I'm an advocate for people around the world with Lyme disease. There are millions and millions and millions of people worldwide with Lyme disease, and millions more who don't know they have it. It's not until your immune system fails that you'll find out.
Thank you.
Delegate Szeliga, followed by Olston.
Thank you, Madam Chair.
You're
Thanks for
welcome.
being here. Good to see you, Jim. So in 2020, this committee passed a bill. We had heard a few years of testimony about Lyme's and, the terrible effects of it. And it was actually my bill. We opened it up to make sure that physicians could practice integrative complementary alternative or non-conventional treatment for Lyme's. Because the challenge then was, as we still have, finding a Lyme's literate doctor, as you said, and then those that were afraid that their treatments would equal complaints to the physician board if somebody wasn't happy with the outcome. So we worked on that, but perhaps, Jim, was there anything beyond the antibiotics that you saw that helped? My son has Lyme's, and he also got the Lone Star tick that makes a meat
Alpha-gal.
allergy. He had that for 7 years. And so it is really tough. And, this has been decades that he's been dealing with it. Was there anything more than antibiotics?
So, Delegate, I'm reading a book on Peter the Great. And in the early 1700s, you used to go to these places where you would sit in like a hot tub and kind of sweat everything out. And that's what they thought would cure these horrible diseases. And I'm kind of reminded of that when you talk about alternative medication. I'm not speaking as a physician because I'm not one, and Dr. Hill, who's not here, could probably articulate this better. But in all my experiences with all of my constituents and hearings that I've gone through, and personally and with everyone else, I have never seen a treatment that has been effective, period, other than an antibiotic. It's just the way it is. I've seen a lot of people talk about alternative treatments that some sketchy doctors have given them, and this is a disease, so all of you know, that eventually will be fatal. Not all the time, but that's what it is. And before it becomes fatal, it will tear you apart. It will tear you apart with heart attacks, strokes, loss of memory and everything else. And there's no amount of, what did they do to George Washington when he got sick? They used to, yeah, what's it called? Leeching. Yeah. There's no leeching or bleeding. It's antibiotics. And I am living proof right here that it works. And it doesn't work as the protocol was stated by this brave young woman. It doesn't work in a week or 10 days or 2 weeks. It works over a long period of time based on what your doctor and what your doctor looks at. Hopefully a Lyme literate doctor looks at and watches your progress and then says, you know what? I think you're cured. And this is what happened to me on my second go around, but I'm going to give you another month just to make sure. Because the problem is if you don't make sure and you go off, then the spirochetes are all over the place. They reinvigorate, make it 20 times worse, and then it becomes almost impossible to treat. And that's what the problem with this disease is.
All right, you're welcome. Delegate Olston, followed by Chisholm.
Thank you, Madam Chair. I just wanted to thank the good delegate for the books that you gave us last week. I really appreciate it. And Ms. Brianna, I think you did an amazing job and good luck in all your future endeavors. You did great today.
Thank you.
Thank you.
Delegate Chisholm.
Thank you, Madam Chair. And Senator, you just said something that made me want to ask the question. Is there any negative effect that we know of in the medical community for being on the antibiotic too long?
Yeah, I haven't met a doctor who said that there isn't a negative effect of being on antibiotics too long. Of course there is. And they could articulate this better than me because they've been on antibiotics a lot longer than I have. And I'll turn over to them. But before I do, I want to say one thing. You know, do I want to be on antibiotics too long and maybe have a problem with, you know, this or that or whatever? Or do I want to become debilitated, have a stroke, a heart attack, lose my memory, and eventually and not be able to function in society? And that's where the weighing really comes out. But if somebody else wants to respond to the negativity of being on antibiotics too long, if that's okay, Madam Chair.
I can ask, does someone want to answer? I'll ask you a follow-up. Why don't you go ahead and tell us?
Okay, so you're pretty much asking whether we're weighing out. We're just picking between two things. Would you rather have the long-term complications or would you rather suffer with Lyme disease? And I will take a choice out of a hat at this point because I cannot walk. I can't walk. I can't go to school. And the mental toll is so much bigger than even the physical pain. It's just, I'd rather pick, I don't know, heart palpitations from a antibiotic. I don't care. I already have so many symptoms from Lyme disease. I'll take whatever. Absolutely, yeah.
That's exactly right.
Okay.
There's nothing worse than being sick every day when you wake up. Nothing.
Any other questions? I don't see any other. I just want to thank you all for being here and sharing your story and opening up to the committee. We are listening. I want you to feel that you were heard, okay?
Thank you.
Thank you very much.
Thank you, Madam Chair.
You're welcome. Is there Susan Green? Susan Green? Not here. How about Pamela? Okay, Monte Skull, Monte? Is Monte here? Skall? No? Okay. How about Pamela Andrews? Will you bring her up? She's on virtual. Let me know when she's there, please. Thank you so much. We don't have someone for the joint audit. Oh, 1 second. Pamela Andrews, will you be so kind and get started, please? Good afternoon. Can you give us your testimony, Miss Andrews? Can you unmute yourself? Go ahead.
Yes, my name is Pamela Andrews, and I am president of the Lyme Disease Association of Delmarva, which was founded in April of 2003. And I've also written a book called Lyme Disease, A Love Story, which I have asked to be given to each of you. The reason I chose to write a novel is that it's a more effective way of discovering the truth, since I've talked to so many people who have had Lyme disease, probably hundreds, literally thousands maybe of people. The point that I would like most to make, the salient points, are chronic Lyme disease does exist. There are organizations throughout our nation who are trying to say they do not, but they do. And I would reference you the work of Dr. Ying Zhang with the Bloomberg School of Medicine and Public Health. His research proves that Lyme disease, chronic Lyme disease, does exist because antibiotics given just short term don't always eradicate Lyme disease. We also need to educate our doctors about tick-borne diseases and the chronicity of Lyme disease. And we need our health insurance companies to help us with paying for the treatments. Myself, in many years, she got Lyme disease in 1991 and has been sick with it ever since then, and after aggressive treatment. So there is such a thing as chronic Lyme disease, and short-term antibiotics do not address it. As a matter of fact, I saw in some of the testimony the use of the term post-treatment Lyme disease syndrome, and that really is not post-treatment Lyme disease syndrome. It is ineffectively treated Lyme disease syndrome. I suppose my time is up, but if there are any questions, I'll be happy to answer.
Okay, well, thank you, and thank you for sharing your story. And we did, in fact, receive the books. Thank you so much for such a gesture.
And I also did send in written testimony.
Thank you so much, and we certainly will, read everything. Thank you. Are there any questions for Ms. Andrews? Seeing now, Ms. Andrews, thank you for being with us today and for sharing your story. You have a blessed evening.
Thank you.
Thank you. This actually concludes the bill hearing on House Bill 1351. I don't have anyone here for 1501. It's Solomon, right? And Howard County delegation. Anyone here for the Howard County delegation? Oh, yes. Why don't you go ahead? I love to hear that. Yes. Delegate Kurt, I'll call you next. Thank you. Good afternoon. How are you, Delegate Gazzoni?
I am well, thank you, Madam Chair. So good afternoon, Madam Chair, Madam Vice Chair, and members of the Health and Government Operations Committee. I'm Delegate Pam Gazzoni, here today representing the Howard County delegation in support of House Bill 1383, Howard County Board of Education Liquidated Damages Model Policy and Requirements. HB 1383 sets up a process to develop a model policy on the use of liquidated damages within Howard County Public School System procurement contracts. This bill requires the Howard County Board of Education, in consultation with the Howard County Executive and the Howard County Council, to develop and publish this model. It will also require any student transportation procurement contract valued at $1 million or more to include a liquidated damages clause consistent with the model policy. Liquidated damage requirements are important to have in contracts to ensure that there is some way to hold contractors accountable for what they have signed up to provide. Last year, we passed state legislation heard in this committee to require liquidated damages in state contracts above a certain size. This bill is designed to protect HB 1383 is designed to protect the Howard County School funding in a similar way. Similar to the state legislation, this bill allows the Board of Education to waive liquidated damages in a contract as long as they keep documentation of that decision, particularly for audit purposes. Nor are we taking away the authority of the board to choose not to invoke the liquidated damage contract clause if it is not appropriate. And again, documentation of such a decision is required to be maintained. We understand that all HCPSS recent contracts have included liquidated damages clause, but this wasn't always the case. And this bill ensures that the current practice continues to be followed going forward.
Thank you, Delegate.
You're welcome.
Are there any questions for the delegate? Seeing none, I do have a couple. Did you see the Howard County Public School System letter?
I did.
Urging an unfavorable. And did you see the Maryland Association of Board of Education urging an unfavorable?
Yes.
Okay. All right. No problem. Thank you so much for your testimony. We really appreciate you presenting House Bill 1383. This concludes the bill hearing on House Bill 1383. Let's go to House Bill 1158, Delegate Kurt. State Government Attorney General reports. And I know staff is listening to the hearing. Can you be so kind and call Delegate Solomon regarding House Bill 1501? Thank you.
Madam Chair, my panel is virtual.
Okay, I have Patrick Hughes. Is this it? Will you be so kind and bring Patrick Hughes up, please? Good afternoon, Delegate Kurt, and you're testifying on House Bill 1158.
That's right.
Thank
Thank you,
you.
Madam Chair. Good afternoon again, everyone. I am Delegate Ken Kerr here with House Bill 1158 State Government Attorney General Reports. This is a bill about efficiency. The HB 1158 repeals the requirement that the Attorney General report to the Governor and Legislative Policy Committee on actions taken under the Maryland Defense Act, including investigations, prosecution, and defense against any action undertaken by the federal government that endangers public interest or welfare in the citizens of Maryland. The bill also repeals the requirement that the Office of the Attorney General publish a bound volume of the Attorney General's opinion from the prior year in an annual report. It's expected that this bill will have no material effect on state operations or finances, but the OAG will realize some administrative efficiencies with the passage of this bill if these reporting requirements are repealed. And I would request a favorable report.
Done?
I'm finished, yes.
All right. So let's go. That was anticlimactic.
Here's
I'm
Patrick.
sorry. Patrick Hughes.
Hi, Madam Chair. Thanks so much. Thanks to the
Hi,
members
how
of the
are you?
committee. I'm good. How are you?
I'm good. Oh, thank you for asking.
Thanks for the opportunity to talk to you today in support of HB 1158. My name is Patrick Hughes. I'm the Chief Counsel for Opinions and Advice with the Office of the Attorney General. As the sponsor explained, this bill makes changes to two reporting requirements for the OAG. First, it eliminates the requirement to submit a report under the Maryland Defense Act. The Defense Act allows the AG to bring lawsuits to protect the state and its residents against harmful actions taken by the federal government. Producing the report, however, takes approximately 80 hours of staff time per year across multiple divisions of OAG, time that would be more efficiently spent litigating cases on behalf of Marylanders. And second, and the reason I'm here today, is it eliminates the requirement that OAG's annual report include an itemized statement of the receipts and disbursements of the Attorney General during the preceding fiscal year. It also eliminates the requirement that the annual report be published in a bound volume, along with the official opinions of the Attorney General from the prior year.
Thank you.
The financial statements are not required to be in other agencies' reports. In today's digital world, there's no reason the annual reports need to be published in a bound volume, as opposed to being put on the AG's website. And although our office plans to continue publishing bound volumes of the official opinions piece of it, the elimination of the express publication requirement will provide our office with more flexibility and also reduce the cost of doing so. So we urge a favorable report on HB 1158. Thank you very much.
Thank you very much. I have a question for you, Mr. Hughes, and I think you're the appropriate person. Are you familiar with Senate Bill 669 for this session? It is Senator Charles' bill. It passed the Senate 46-0.
Yeah, it's the cross file of this one, or
It's not designated as a cross file, but it's very similar to this one. So you are?
Yes,
Okay.
I am.
Okay, great, because they're like very, very similar bills. So do you want us to match these two bills?
So my understanding is that the bill that's before you, the House bill, is the one that is preferable to the Office of the Attorney General between the two, because this one eliminates the requirement that the annual report include the itemized financial statements in them, which I think for some reason was omitted from the Senate bill. My understanding from our legislative folks is that the House bill version is the preferred version for the office of the.
But Mr. Hughes, the Senate version, everything in the Senate version is in the House version, correct? Or what is different? It has to be published on the website, is that not?
So it's almost entirely identical. My understanding, forgive me, is that the difference is the House bill version eliminates the requirement that the annual report include itemized financial statements in them, which we would like to be eliminated from the legal requirement for the annual report because the no other agencies in their annual report have to include that itemized financial statement, which one can get from looking at the budget books anyway. So it's sort of an archaic requirement that applies to OAG's annual report. I believe that's the only significant difference between the two versions of the bill. But if that's not true, I can follow up with our legislative
Council is
hearing and get
showing
back
me,
to you.
so it's right, you deleted on the Senate deleted the whole section dealing with on or before December 1st each year, the Attorney General shall report to the governor in accordance with Section 2-1257 of this article, the Legislative Policy Committee on any action taken under this section. As well, and many other things they deleted, but I have to tell you, it will be hard to pass both, so we're gonna have to merge them, okay?
Yes.
So you can work with the subcommittee and with the attorney, Ms. Rowe, work with her so that we can come to some agreement, okay? In conclusion.
Yes, yep, absolutely, no problem. We will.
Lindsay, that's it. I'm glad you brought that up. Thank you. Are there any other questions? Delegate Bagno?
You, Madam Chair, I just noticed that our hardworking library systems also offered an amendment just speaking to the Maryland Uniform Electronic Legal Materials Act. Is this are you familiar with it? And this is a friendly amendment that we might also want to communicate across the chamber.
Patrick,
do you have the answer?
I have not seen the amendment. I apologize. I don't know if our legislative folks have it and haven't passed it along to me. So I haven't seen it. I'm aware of the statute that Delegate Bagnall is talking about, but I would need to look at the amendment and talk with folks in the AG's office to figure out what our position on it might be.
All right, well, Delegate Kerr actually chairs the subcommittee where this bill will go. So if you can work with Delegate Kerr and the senator across the street and try to figure it out so that our attorney has some direction, okay?
Absolutely. Thank you, Madam Chair.
Thank you very much. Any other questions or concerns? Seeing none, thank you very much for being with us and thank you for working with our committee, okay? On a lot of these issues, we really appreciate it. I hope you have a blessed evening.
Thanks, you too.
You're welcome. This actually concludes the bill hearing on House Bill 1158. We do not, is there someone here for the Joint Audit and Evaluation Committee? No. May we have Delegate Martinez, your bill? Thank you. Okay, we'll wait a minute. Can I ask you, can you tell the Sun Girl to Delegate Solomon, to post Solomon? Because I believe he's giving that testimony. Okay. And you have 1, 2, 3, 4, 5, 6, 7, 8, 9 people. Yeah, that's it. So we'll wait for them. The other bill that we have left for the committee's planning purposes, House Bill 1501, we are waiting for Delegate Solomon. I just sent someone to give him a call. And that should be a short bill as well, so. Let's see. Okay. Okay. After this, we have review. Okay.
That works for me.
I know. I asked Delegate Kipke to show you the note I gave him.
Was I supposed to pass it around?
No, just too hard. We're live. Okay. It's okay. So we are waiting for Delegate. Do you like to get started on your
get going.
testimony?
Yeah, I'll get going. Most of my folks were held up in the Prince George's County delegation room because they have space, but my staff is getting them, so I'll get started.
If you could get started, that would be great.
I appreciate it.
Thank you.
Thank you so much, Madam Chair. And colleagues, for the record, I'm Delegate Ashanti Martinez, here to present House Bill 1327, the Maryland Department of Health Body Altering Aesthetics Advisory Committee Bill. HB 1327 establishes the Body Altering Aesthetics Advisory Committee under the Maryland Department of Health. The committee would be responsible for looking into whether current health occupations, licensing, and certification systems adequately regulate the body altering aesthetics industry. This committee must submit its interim findings by December 1st, 2024, and its final report by December 1st, 2025. Today, when they get here, I'll have a panel of folks directly in the industry who can talk to the need and the seriousness for this bill. You know, to me, this bill is necessary because it amplifies a proactive approach to improving the body altering aesthetics industry. Within the last 8 years, the plastic surgery industry has increased 32%. More people are getting surgery than ever before. For example, Maryland is one of the states in which people are most interested in plastic surgeries. In Maryland alone, for every 100,000 Google searches, almost 300 of them are about procedures regarding plastic surgery. This rise in interest alone prompts the need to have a body altering aesthetics advisory committee to ensure the safety and well-being of patients. With the advisory committee set in place, we are actively seeking to reduce any unsafe practices that are and could potentially affect Maryland residents. This committee would enforce what our regulatory boards are doing to ensure that everyone practicing within the industry receive the adequate and necessary training. Setting up the advisory committee is vital to prioritizing patient care. And this bill, we believe, is a huge step to ensuring that the standards of care for patients are not only acknowledged, but also set in place. In your committee testimony, you'll see letters of information from a few of our boards, as well as the Department of Health. I did have a conversation with the Department of Health yesterday, just to have a broader understanding for them about what their position would be and really what body altering aesthetics is. This is a very much emerging market and industry, and so they had some questions around how that was being defined. You'll also see a letter of information from the physical therapists about adding a physical therapist to the list of stakeholders. I'm amenable to that. I think they should be part of this conversation. And it was probably just an oversight that they were left out to begin with. The Board of Physicians in their letter expressed concerns regarding the definition of body altering aesthetics because there are similar setup in COMAR of the cosmetic procedures, medical procedures. They have regulatory authority over that. I'm fine with amending language to have that if it makes more sense. I know it's something that's already established. It was worked out in 2018, and so I'm not opposed from that. And of course, I asked for a favorable review of House Bill 1327. And I think, yep, my panel's here.
Okay, who's Miss Larissa? Is there a Miss Larissa here?
She had to leave.
Okay, 1 second.
And her testimony is gonna be.
Yep.
All right, how about Ms. Kim Michael? Oh,
She also has left.
okay, 1 second. Kristen Jacobs,
Yep, come on up.
if you can come up. Ray Van Kooten.
He left as well.
He left?
Mhm.
Okay, 1 second. Katie Marie Fickling?
She has, no, she's here. Boom. If you could pull up chairs as well, and we'll make sure we share the mic.
And the last one for this panel, if you could put another chair, is Hajera.
She couldn't be here.
Okay.
But, say your name.
How about Tamika? Tamika Gray Sugma?
She's not here.
Okay. How about Ashley McIntosh?
She's here.
Will you come up and let's get started? The
And then also
delegates-
Ty Brown is right next.
Yeah, I'm gonna call Ty after.
Okay.
So, yeah.
Boom.
Actually, just Ty Brown, why don't you come up and that does it?
Yep, she's right here. Next.
And
to me.
Ashley's here? Okay, why don't you, Ashley, why don't you get started?
Yep, we'll go this way.
You can move the microphone a little closer, just, yep.
Good
got it.
afternoon.
Thank you. And thanks everyone for your patience. Go ahead.
Okay. Good afternoon. My name is Dr. Ashley McIntosh. And I'm a veterinarian by trade. So, as a veterinarian, I understand that trauma, but from a different standpoint. Due to my medical background, I have the awareness to know that I need comprehensive post-operative monitoring and care. And at the time of my surgery, I had lost approximately 130 pounds and had excessive skin that did not retract with proper diet and exercise. So I underwent an extensive cosmetic surgical procedure. So I went under abdominoplasty and mastopexy. During my pre-op visits, I asked my doctor about their post-operative recommendations. My surgeon was supportive of me receiving post-op treatment and even provided me with a recommendation of a reputable facility that specialized in post-surgical care. In preparation for my surgery, I received pre-op massage that would minimize inflammation and bruising. And then when I was in the process of choosing a provider, I make sure I review their credentials before securing their services to ensure that they're qualified and knowledgeable about their anatomical and effective physiological systems, as well as knowledgeable about the services they render. Currently, this industry has become a money grab for unsuspecting patients and clients. And since there are no regulatory entities overseeing this niche industry, individuals are performing treatments lacking appropriate medical background experience or even exposure to proper education. Thus, they're making things up in this booming industry. Post-operatively, my surgeon was impressed with my results in conjunction with the treatments, as well as the monitoring from my surgical staff. Had I not received proper post-operative care in conjunction with the post-surgical monitoring, I could have easily undone my surgeon's work, thus compromising my health and financial investment. So I was fortunate to have a relatively smooth recovery due to the high quality post-operative education, knowledge, and extensive training of my specialists. But as more people continue to undergo cosmetic procedures, their health and safety should not be left up to chance, popularity, or social media. It should be in the forefront of their minds and both their surgeon and patient alike. Thank you.
Thank you. Who would like to go next, please?
Hi, my name is Kristen Jacobs. I've been a caretaker for my entire life, giving all of my energy to my family and children. I finally decided to do something for myself in 2020. I saved up money and got a mommy makeover consisting of a tummy tuck and a breast lift. I just wanted to do something for me. My breast operation didn't go well, and I had to have a series of 4 follow-up surgeries as I started experiencing complications at 2 days post-op. I spoke with my doctor 4 days after surgery, and my doctor told me I needed to go to the ER. I winded up in the ER twice. One of those times I had to call the doctor crying, begging for help for her to advocate for me, as the ER staff was disregarding my pain with a high level of judgment and disrespect. I was treated like a second-class citizen, treated like a burden because my surgery was elective. I saw the sense of urgency leave their bodies as they discovered my original surgery wasn't medically necessary. I was only admitted after my doctor advocated for me. and I underwent life-saving surgery the next morning. No one explained the procedure to me. I woke up alone and lost with instructions connected to hoses, tubes, and machines. I was trying to ask for help, but I was being ignored. I texted my doctor from the recovery room and said, "Can you please add something to my chart? I don't know what, but something that lets them know that I can't handle this. I'm terrified, scared, and need more assistance than what they're providing me with." I had 4 additional surgeries and a wound vac for 3 months. One surgery was a skin graft from my right arm to my left breast, which is the large cover-up tattoo that you see today. Later, my arm incision actually opened up. My doctor didn't educate me on proper showering or wound care. I needed ongoing in-home post-operative care. If I didn't have the assistance of ongoing care from an RN who was well-versed in plastic surgery recovery, I would not have survived. Although my doctor was great, she had no education in post-op care. My nurse and my post-op surgical massage therapist, who's actually here, Kelly.
Finish, go ahead and finish up.
Thank you. My nurse and my post-op surgical massage therapist both had to advocate, identify, and guide my surgeon. While unfortunate, I'm not mad that something happened or that I got infections and complications from surgery. I'm disgusted at how I was handled in the ER, didn't have proper education to effectively assist me. They have no awareness or education to help plastic surgery clients. Traditional medicine failed me because I chose to do this, and the ongoing care that I needed was only received because my nurse had taken some additional trainings that aren't even covered by her license. Thank you.
Thank you, and thank you for sharing your story. We're so sorry that you went through that and as
you so
well as you,
much.
Ms. Brown.
It was very difficult.
Next, please.
Hi, I am Katie Marie. My last name is Fickling. So on November 2020 is when I sent my first photo into the surgery center by choice to be looked upon or reviewed for a specific surgeon. Due to my thorough research after 19 years of having several consultations, questions that were answered in Facebook groups, Instagram groups, interviewing friends in the medical field, friends who had already had surgery and cosmetic surgery, and write-ups via magazines and news articles, and also on YouTube. The surgeon I chose practiced in Atlanta, Georgia. Surgery locally is different from surgery done from cosmetic tourism. I had a lipo 360, additional back fat removed, and also a BBL in July of 2021. While I had surgery in another state, which is common for a lot of Maryland residents, I spent 1 week in recovery in Atlanta, and the remaining years of recovery was here in Maryland. As I spoke with several individuals and also trying to get through to speak with my surgeon of choice, I was denied the ability to speak with my surgeon and only was able to speak with my surgeon in my pre-op appointment, which was on a Monday. If your surgery is on a Monday, you do not have the opportunity to speak with your surgeon or meet with your surgeon beforehand. So once I was in the room, that's when I got all of my drawings, and I also got the questions answered that I was looking for. My surgery was absolutely successful. However, once my surgery is over and I woke up in the recovery room, I was actually dumped out into a back door or out of a back door to the person who was picking me up, and I did not hear anything until the next day. Once I saw the doctor the next day, I only spent 15 minutes where I was supposed to get a post-op massage and to get drainage. However, I only had the 15 minutes, so certain things were not taken care of. I then got discharge information, and it was basic information as if I was discharged from a hospital. When I traveled back to Maryland, I spiraled, actually. I followed the instructions. I took my medication. The flight was supposed to be an hour and a half. My flight was delayed for 6 hours. So I had no medication and I had no way of contacting the doctor to get any instructions of assistance. Once I got back to Maryland, that was it. I was supposed to have a three-month appointment. I never had an appointment. I never spoke with anyone from there. The only reason why I was able to get the type of care that I received was based upon the individuals who knew exactly what to do with the post-op massages. So although we go to these surgeons and they assist us for the look that we need some further instructions, and we also need some extensive care afterwards because there are certain things that take place that we're unaware of. So thank you for your time.
Thank you, and thank you for sharing your story with us. Next, please.
Good evening. My name is Ty Brown. I'm one of the founding members of the organization in front of you today that cultivated the body altering aesthetics industry. I'm a retired massage therapist, scientist, and author. During my bodywork profession of almost 18 years, I worked on over 33,000 people, most of which were post-surgically related. I've studied in over 30 countries, learning the skills in progressive medicine to care for clients post-operatively. Tosa University has trained 1,200 plus students in 42 countries, 13% of which are surgeons and 29% are nurses. And the ones here in America, specifically Maryland, have no representation. Everything we do to care for clients is deemed out of scope and practice unless someone is certified and licensed in multiple professions. Here, we have a list of healthcare requirements clients need after surgery, and the limitations of each profession statewide is listed. We will be able to submit this to the committee for review. MTs aren't taught or allowed to perform wound care. It is out of scope of practice for nurses to perform massage. Estheticians aren't allowed to do either of those things. Cosmetologists, phlebotomists, and CNAs are allowed to do even less. PTs and OTs are missing the vital information for proper post-op care for this niche individual client group. During my practice, I would see 10 to 15 new surgical clients a week. To this day, healthcare professionals maintain the same rate as surgeons performing procedures has only increased daily. Clients are with surgeons for one day. They are with us for years. After surgery, the lymphatic system doesn't reassemble properly, leaving clients with the need for ongoing non-surgical care. We studied all 361 surgical residencies in America, and not one teaches surgeons more than 15 hours of lymphatic system education, and only 5 offer post-op instructions to residents. Over the last 10 years, we have successfully developed standards of care that we employ during a client's post and ongoing maintenance journey. You need the medical support, representation, regulation, and acknowledgement to legally practice and provide the treatments that clients in the state of Maryland need. We often joke that clients get better instructions when they get a tattoo than when they get surgery. Today, we are asking for an advisory board to be approved to further study the needs, indications, and impacts these gaps have created. Thank you.
Thank you, and thank you for your support of your patients. I think you have not gone yet?
Weren't able to get you on the panel. So that is all on terms of folks testifying.
Okay.
Yep.
Is there anyone else here who is signed up to speak that?
I don't
didn't get a
think my
chance?
panel was signed up. Yeah.
Okay. All right, well, I would ask if there are any questions from the committee. Delegate Hutchinson.
Delegate
Oh,
Martinez,
sure.
just out of curiosity, because I don't fully understand the term body altering aesthetics, but does gender affirming care fall under that as well?
Yes, so you can get surgeries that will affirm your gender identity, and that would fall under this.
I will add though, Delegate, that many, what we're hearing from them today is that many of their surgeries were elective, whereas gender affirming care is often identified as medically necessary. So
Absolutely.
it falls into a different category. Same procedure in many cases, but one is medically necessary. Delegate Alston.
Thank you, Madam Chair. I'm just wondering, so you want the board to just come up with a set of criteria that people should follow and to educate? I'm just want to make sure I'm understanding correctly, and I'm sorry I wasn't here when you testified.
No, I appreciate the question, Delegate. So the idea behind this bill was how do we bring all of the health occupations, all of the practitioners, all of the folks that are stakeholders together on an advisory committee within the Department of Health to figure out what those gaps are. there's clearly a lack of communication and just guidance around post-surgical care and even some pre-op things as well, that I feel like this committee can come up with recommendations on how best to move forward. I truly believe that, and the reason why I'm sponsoring this bill is that all of our care settings deserve to have the highest standards. And so I just want to make sure, even if it is elective surgery, that we're treating folks with the best possible care possible.
Thank you, Delegate. Delegate Lewis.
Thank you. Thank you, Madam Chair. Thank you, Delegate Martinez, for this thoughtful bill. And thanks to all your panelists. And I'm so sorry for what you've gone through. But that's why we're here, to solve problems together. I wish Delegate Hill were in the room. One of our colleagues is literally a board certified plastic surgeon. And while she'll swoop in, on her magic carpet as we're finishing, but she's probably but she's in a bill hearing, I'm sure. But in her absence, I'm curious. This committee has jurisdiction over all healthcare professions, medicine or physicians, nurses, everything, every cadre. And my first question is, for those who've experienced medical care here in the state of Maryland, there was one young lady who talked about an experience in Georgia, but leaving aside that case, for those who've received medical care from licensed physicians in the state of Maryland, if those physicians, whether they were plastic surgeons or whatever, if they didn't provide the proper standard of care, there are already built-in provisions to hold them accountable. There's a board of physicians, et cetera. I'd like to know if our existing systems of accountability and licensing are working or not in those cases. Because if not, that's a problem that should be addressed. Anyone who's undergone a surgical procedure in the state of Maryland should have been treated with a basic standard of care outlined in our requirements. So if that wasn't done, it's my understanding anyone here who didn't receive this proper standard has a mechanism in place already for accountability, for remedy, okay? Physicians have malpractice insurance for a reason. So are our current systems not working for those who've been harmed? That's my first question. And whoever's best to answer.
We have been in conversations with the health department and the board of physicians, but unfortunately, while some of these cases are medically necessary, those that are elective, they sign waivers that remove a lot of their rights, and they wind up being mishandled when they reach out to report their experiences. There's no client advocacy. And then if they do say something, they are threatened with lawsuits and slander and libel for defamation of character of the facilities, that when the cases do even make it to the board of physicians, it doesn't have the substantiation to be able to properly represent the client, or the client even knowing that they have rights because of the threats they receive before their complaints make it to the board.
Yes, please.
So thank you for that answer. My follow-up question is this. Delegate Martinez, I see all of your panelists are African-American women. And it makes me wonder if there's some disparate treatment going on, if there's a pattern, or if it just so happens to be these are the courageous people who stood up and asked for help. And that's not unusual either, Black women standing up to get help for themselves and others. What do we know about the patterns about outcomes for African-American women seeking these types of this type of medical care, elective, body, whatever you call it? These elective procedure, altering procedures, yeah.
I think this is not an or, but an and, right? I think it's both of those things. I think In this particular instance, these folks came to me with their concern because they weren't being heard through the traditional channels. And they wanted to actually create a health occupations board with all of these other, folks involved to try to really get at the issue. But a committee is what we came up with because we wanted to ensure that all of the stakeholders' voices were involved and that we could come up with solutions. I think, unfortunately, we know where we live and we know the history of that, and particularly in the medical field, we hear it every day in this committee. So I think that is a part of it. But also we know that Black women lead. And I think this panel of folks displays that.
Thank you, Delegate, for the question. And I'm going to break a rule and ask a follow-up question. Wouldn't the advisory committee be able to help us tease that out?
Oh, absolutely. And that's why there's not clear or narrow focus. I want this committee to be able to do as much work repairing any harm that's out there.
Great. Thank you very much. Okay. Delegate White Holland.
Thank you, Madam Chair, and thank you, Delegate Martinez, for bringing this bill. And thank you, ladies, for sharing with us and telling your stories. And again, Delegate Lewis, you were in my head. So I was thinking, though, the same thing. I literally wrote down that question. What recourse, do patients have in this situation? And it tells me that our systems may not be working to the best that they could. And so another question that I have for you, Delegate Martinez, I know that this was something that was brought together by those here, but in working through this bill, have you had any, aside from the Board of Physicians and the Health Department, have you explored this conversation with other health occupations boards? And has there been, given the growing number of these types of procedures, it makes me wonder, have they had any internal discussions and how they might be, looking at this? But I guess since the reason why you're bringing this bill is because they're not having that conversation. And so it seems to me that you're calling this to attention, but have there been have they elevated this in your conversations with any of the health occupations boards regarding the trends and the, seeing the increase of these procedures? So could you share a little bit more about that?
Of course. So thank you for the question, Delegate. So outside of the folks that submitted letters, I haven't had broad conversations with those particular health occupations. I did talk to our resident physician, Delegate Terry Hill. And so she got the copy of the bill a few weeks ahead of the hearing. She regrets that she couldn't be here, but we are having conversations with her because she is an expert in this to try to help guide us. I mentioned in my testimony that in 2018, the Board of Physicians came here to talk about, I think it's cosmetic procedures, something like that, that's in Comar. I'm willing to have more conversations with them about how they define what those procedures or practices are, and making sure that all of the stakeholders are continuing to have those conversations with them, because I don't think everyone's talking to each other. They might be talking, but it's not to each other. And I think that's what's causing a lot of these gaps in care. Absolutely.
All right. Thank you.
Thank you, Delegate. Delegate Bagnall.
Thank you, Madam Chair, and thank you for this very thoughtful bill. I think we've all been trying to sort of hone in on the problem that we're trying to solve. And it sounds like we just have a lack of standardization for standard of care. When often when we're talking about standard of care, we're talking about, dealing with symptoms, illnesses, injuries, and what that recovery looks like, what that expectation looks like, what the pre-op, what the post-op, what the risks assessments are. But we don't have a similar sort of standard for achieving the aesthetic expectation, whereas we have it for achieving the recovery expectation. Is that sort of, is that the problem that we think we can solve with this commission?
Yes, we are looking to solve the lack of standard care across the board, but then also having a level of awareness when it comes to the allowances of professionals to provide that care. We are absorbing and bridging the gaps of client surgical care, pre, peri, and post-operative, to have better, safer outcomes for the public at large.
Sure.
probably more of a statement than a question, but I just want to say thank you and that we appreciate this because we try and be agnostic with healthcare. And it sounds like maybe this is an area where we need to focus in on making sure that we're not providing healthcare through a judgmental lens.
Thank you.
Seeing no further questions, I have a couple. First of all, I again want to thank you all for coming forward and bringing this issue to us. It is something that we've not heard before, and I've been here 14 years, and I am happy that we are now aware of it. I am extremely concerned over the notion that that folks are being asked to sign forms that give away their rights regarding their health care. So just if it's possible, if one of you have a copy of a form like that, I would be very interested in getting that. I also am interested if anyone made a complaint to our the health and education and what's the A? HEAU. What's the A? Health. What is it? And advocacy. The Health Education and Advocacy Unit of the Attorney General's office. If you haven't, I'm saying let's look at whether or not this commission can move forward, but you may want to look at the AG's website and literally file a complaint. I don't think it's too late. This is something, again, I think the AG's office needs to be aware of. And, because again, I heard an instance of, at least one instance of intimidation and threatening. These are very concerning perceptions that folks have. So if you could follow up with the forms, and Delegate, thank you for bringing this to us, and we'll, be taking this into consideration. So
I thank the committee.
Thank you. With that concludes the hearing on House Bill 1327.
Thank you.
And we will go welcome Delegate Solomon, otherwise known as Chair, Joint Audit and Evaluation Committee, State Government Office of Legislative Office, Performance Audits. This is House Bill 1501. Really missed carry on.
Good afternoon, everybody. Sorry for the mix-up. We actually didn't know that the bill had been pulled out of rules. So that was an interesting surprise. I was like, bill hearing for a bill that I didn't even realize was being heard. So thank you all for your flexibility. And thank you, Madam Chair. As you mentioned, this is a bill that I'm bringing on behalf of the Joint Audits Committee in my role as the House co-chair of the Joint Audits Committee, along with Senator Lamb over on the Senate side. And this is a bill actually that was brought to us by the Office of Legislative Audits. We had a little bit of a mix-up at the beginning of session. We thought it had been filed jointly between the two of us. It hadn't. That's why it was late, and it went to rules. And the Senate bill is actually already over, passed unanimously. Basically, what this bill does is at the request again of the Office of Legislative Audits, it changes the timing for the audits that OLA is supposed to do for the Baltimore City Liquor Board and the Prince George's County Liquor Board from every 4 years for Baltimore City and every 3 years for Prince George's, and changes it to essentially the standard 6 years, which is the standard amount of local oversight, or the standard time frame that OLA provides for local audits. Just by a little bit of context and background, the audits that they have done for the city and Prince George's County liquor boards took anywhere between 280 and 570 audit days, and 185 audit days is about one auditor per year. And so this has taken a fair amount of time away from OLA's responsibilities for things like MDH or MDOT, which we know have had some really egregious audits over the last couple of years, and puts it into a place where frankly, they believe right now the 6-year cycle for local audits is appropriate. To put folks a little bit at ease, because those audit requirements were actually passed in statute back in 2011. There was a bill that has been passed since and is now law that gives the Speaker and the Senate President the ability to request an audit by OLA of any local liquor board. So if for some reason in the interim, in that 6-year period, if something had gone wrong, not only with Prince George's or Baltimore City, or frankly, any liquor board in the state, the presiding officers of either chamber could request OLA to do a local audit of those liquor boards. So we feel like there are belts and suspenders here to make sure that not only are we preserving the limited resources that OLA has for really egregious issues within state government, again, consistently making these liquor boards part of the local oversight, but we still have that backstop there in case something were to happen that the presiding officers again could request. So again, this bill passed unanimously out of the Senate and would urge a favorable report. And again, thank you for your indulgence and flexibility.
Thank you for answering the call. Are there questions for Delegate Solomon? I do have a question.
Sure.
It sounds perfectly reasonable to me. I'm wondering, is part of the rationale that there just haven't been many issues?
Yeah, actually, that's a great question. So the number of audit findings have significantly decreased. I didn't write it down, but it went from something like in the mid-20s to low single digits. And again, OLA feels like the 6-year cycle is also the appropriate time frame to give the liquor boards the ability to fix the audit findings, like any other local agency that they would audit.
Okay, great. Thank you. If there are no questions from the committee, there are no other witnesses, and it concludes the hearing for House Bill 1501.
Thank you.
And the work before us today. I will say we are voting at 6 o'clock today. So please come back here at 6. The committee members should come back here at 6 o'clock. Those of us who will be doing a review meeting, I would ask that we go into the committee room and see what the status of the chair is. And with that, we say good evening to those who are watching, and we will proceed